Hello, let's learn cardiac cycle. So here we can see this is pulmonary artery, this is aorta, this is pulmonary veins, and these are two atrium and this is two ventricles. So firstly there is atrial systole. So the rest of the amount of the blood in the atrium enter in the ventricles. So after the atrial systole, here the mitral and the tricuspid valve are closed and we can see the S1 sound. We can also write it like this, M1T1 closure, because mitral first and then tricuspid valve are closed. So that's why I'm writing it here like M1T1 closure. This is aorta, this is pulmonary artery. So in this step there is no blood enter into the heart and no blood going outside of the heart. That's why we are called is like isovolumetric contraction. So after the closure of the mitral and tricuspid valve, pressure increased within the ventricles. That's why aortic valve and pulmonary valve are open. We called it ejection click. The opening of the aortic valve and pulmonary valve, we called it ejection click. The 80 ml of the blood enter into the aorta and 80 ml of the blood enter into the pulmonary artery in the step of ventricular systole. After the blood enter into the aorta and the pulmonary artery, the pressure is relatively less in the ventricles. Then the aortic valve and the pulmonary valve are closed. Here we can find S2 sound. We can also write it like A2P2 closure. And here there is an isovolumetric relaxation. When the free flowing of the blood from the inferior vena cava and the pulmonary veins enter into the heart. Lastly, in the ventricular diastole, the blood enters into the ventricle and the opening of the mitral valve and the tricuspid valve are called opening snap. As there is a decreased pressure in the ventricles and blood is free flowing from the outside into the atrium, then the opening of the mitral and the tricuspid valve happen and it is called opening snap.